Hello, welcome everyone. We are here with Breath to Breath, and I am so delighted to introduce Barbara Babz Jackson. Thank you so much for being here, Babz.
Thank you for having me.
Absolutely. I would love to introduce you, and then we'll just dive right into it. Barbara Babz Jackson is an occupational therapist, lymphedema therapist, and certified yoga teacher. Babz currently specializes in the lymphatic system and works in a cancer rehab and an orthopedic setting. She teaches a virtual adaptive yoga wellness program, which I have been a party of. It is amazing. And also helps and works with individuals at risk of or being diagnosed with lymphedema or lipedema, and has created a specific practice called lymphatic flow yoga. And this is the best. She's inspired by her mom, who's a breast cancer survivor and who has left upper extremity lymphedema. Babz, thank you so much for being here.
Thank you. Thank you. I'm excited to talk to you and to share this practice.
Oh, God, absolutely. And just a little bit of how this even came about. So I follow Lymph Love Club on Instagram, and I saw that they were having a lymph book club, and literally nothing gets me more jazzed than books on topics I don't know about, but I'm interested about. And then that's how I was introduced to Babz, because you were doing the yoga component. So essentially, we would start off with like a 45-minute flow that Babz led us through that was specifically targeting the lymphatic system. And then we would talk about lymph and longevity, which was literally you, the book. This was my first kind of introduction into the lymphatic system. And I'm still learning, like eyes wide open. There's a lot there that I'm absolutely slowly starting to understand. But what I am just the most excited about is to have you help explain this better than I can. Better than I can to anyone that's watching or listening to this conversation. And so before we even get into like your role, how you got pulled into this and what has really been influential, I'd love just to get our definitions maybe in order. So how would you explain as simply in layman's terms, like what is the lymphatic system? What are we even talking about?
Yeah, I'm glad you asked, and I'm glad that the world is kind of now being like, okay, this is an important system. Let's learn more about it. So I think the awareness is growing by day, thanks to Leah too from Lymph Love Club on Instagram. She's awesome, and I think people like her and a lot of people in the community, the lymphedema, the lipedema community, have been affected by the lymphatic system so much that they're like, why don't people know about this system? Like, so, and that's how I directly got introduced to it too, was through my mom, which you mentioned from breast cancer. But so, what is the lymphatic system? The first question is, so we have all the systems in our body. So, our digestive system, our cardiovascular system, our endocrine system, our nervous system. So, we have just all of these systems in the body. The lymphatic system is one of the systems in the body, but it's just not talked about as much, but it's super important. It's basically what cleanses, what clears, what keeps the flow of our body, of our life, of our mind going. So it's critical. If we didn't have a lymphatic system, then I like to tell my patients we would just blow up like balloon animals. So it's basically our body's system that regulates the flow, regulates the fluid balance in our body. So the main three functions of the lymphatic system are to help the heart, to regulate the fluid in the body, to help the immune system to carry the cells that we need to basically censor the things that are going to be harmful to us, and also to help the digestive system. So it taps into really every system, every other system in the body, and is really important for life and for allowing the rivers to flow through our bodies. And there's a couple analogies that help to define the lymphatic system. So I heard one recently that I've kind of like developed on my own too. So
Let's hear it. Yeah.
so let's try this out. So I think of the heart as like a sloppy waitress. So imagine like a waitress holding a tray of like martinis or something that's like really yummy. So, or something like that people like, but that martini is the blood. So the waitress is the cardiovascular system bringing the blood to all of her people in the restaurant. So, but she's sloppy. So she bumps into a table, bumps into a person, bumps into other people. And some of that martini or blood gets dumped out onto the floor. So our lymphatic system is like the busboy. So the busboy comes in and he's like, oh, there she is again, like dropping all this fluid on the ground. Like, I need to pick it up. So the busboy comes in, goes, okay, I'm going to clean up on aisle 7, clean up over here. Got to take this fluid, takes on all that excess fluid that the heart dumps out, that the waitress dumps out, takes it, brings it to, say, the kitchen, to the dishwasher to be cleaned. The dishwasher is our lymph nodes here. So the fluid's being filtered by the lymph nodes, kind of detecting what's going on. And then the busboy can then put those clean blood or clean dishes back on the shelf. So if you imagine kind of this, the heart pumps the blood through every part of our body, right? It's about, I think, 20 or so liters a day that the heart pumps that fluid throughout the body. About 4 of those liters get dumped out into something called our interstitium, which is basically like this space in our body that the fluid just kind of hangs out in. So the lymphatic system, the busboy, is like, oh, let me take some of that excess fluid, let's clear it, let's figure out what it is, let's fight it if we need to, and then bring it back to the heart to get pumped out again. So that's a major function.
Yeah, no, I like that analogy a lot. And I'm just thinking like I love metaphors and analogies. They make me very happy, but essentially would lymphedema be a dam in the river? Is that why we start to see start part of our extremities engorging and getting large because there's a backup of the flow of the lymphatic system?
Exactly. So imagine that that busboy was really hungover or really or ended up breaking his wrist or something, or something happened to him. And
Yeah.
now he's not able to carry all that fluid back to the kitchen. Then that fluid, that those martinis, that blood, that fluid is just going to fill on the floor and create a puddle on the floor. So yeah, lymphedema is an abnormal accumulation of protein-rich fluid. So it's basically the busboy's not doing his job, the vessels get weakened, and then the fluid's not brought back to the heart, so it just accumulates it. And it can happen anywhere in the body, and it can happen either, there's 2 types of lymphedema. There's primary and there's secondary lymphedema. So primary happens typically through a genetic makeup. So either there's too many lymph vessels, not enough lymph vessels, absent lymph vessels. So and it comes out either through childhood, through adolescence, through big kind of hormonal changes like menopause or things like that. So that's primary, so you can be born with it. Or secondary, like my mom who had cancer, had lymph nodes removed. You can also get secondary from like a severe car accident where the lymph vessels are ruptured, or a sprained ankle or broken ankle, or some type of trauma to the body that then affects the quote unquote normal system from functioning the way it should.
Got it. And then just to be clear, we're talking about lymphedema, lymphedema. And then so what's the difference between lymphedema and lip? As you
Yes.
graciously helped me correct before we start recording, lipedema. Tell me about that.
So lipedema, the first part of that word lipid, so fat, it's a fat metabolizing disorder. So it's different from lymphedema. Lymphedema is something disrupts the lymphatic system. So either the vessels, the nodes, the flow, like you said, something's blocked in that river. Whereas lipedema, the actual adipose tissue, the fat that's throughout the body, is not being broken down. So where these kind of go hand in hand is oftentimes people with lipedema can end up with lymphedema because that fatty deposit is basically blocking the lymph vessels from bringing the fluid. So then they get something called lipolymphedema. So it's a combination, but it's really unfortunate because a lot of people with lipedema, they go to their doctors and normally it's bilateral. So commonly it's in the legs, both legs, but their feet are not swollen. So that's kind of one of the kind of like signs that it's lipedema, not lymphedema, because there's certain specific signs that you can kind of determine what's what. So it's usually happens to both limbs, whereas lymphedema usually is sometimes one limb because one limb was obstructed or from cancer or radiation or something. But lipedema, basically, they'll go to their doctors and the doctor will say, well, try to change your eating habits, try to change your lifestyle habits. And these people are like, I am trying my best. Like, I have so many patients that were like, I starved myself and I did not lose weight. And I'm like, this is horrible. And it's called like I think it's called like the fat disorder or something, or like I forget, there's a term that I think I blocked out of my mind because I just don't like it. But yeah, but regardless, lymphatic flow yoga and kind of the principles that we learn as a lymphedema therapist help with both lymphedema and lipedema to help the person. Yeah.
Thank you so much for helping define those vocabulary terms. I find that I'll start to read something new and I'll recognize it as I'm visually reading it. And then when I go to actually say it, it's just like, I can't, I have trouble pronouncing it correctly. I have trouble like talking about it correctly. And I think it's through conversations of actually asking questions that we start to actually grasp the concept. So thank you for helping kind of lay that foundation. Of course, we'll keep diving into and scratching the surface and getting deeper in those, but let's talk about you if that's okay.
Sure. Yeah.
So I always start off with what is your breath of origin? And essentially that's how did you get here? It might be your lymphedema breath of origin. It could be like through your mom, anything, but essentially, how do we how do we start to know the Babz that is here in front of us? Like, what was that journey like for you?
Yeah, before I talk about me, I just want to say that thank you. I just listened to your episode 7 of your journey and of your, and I was like, wow, that it's so powerful because you, like many of these people with lymphedema and lipedema, had to go through this medical struggle of finding help and being a self advocate for yourself, and just listening to how your dad was helping you, and you were trying to navigate this problem that all the doctors were like, oh, idiopathic, like whatever, like we don't
Idiopathic
have essentially.
hypersomnia. It's like not very encouraging.
Yeah, you're like, well, I now can read medical terminology and I know that's not saying anything. So yeah, I just like, yeah, appreciate you sharing your story and helping other people too, because that's also how you went into your role. So yeah, just wanted to mention that. But
Yeah.
yeah, it means a lot because I think we're similar in a way that the way we chose our profession and the way that we talk to other people and the way that we connect to other people is because of a purpose and because of a passion, and it really shows from your Instagram and from the way that you connect with people on your podcast. So anyways, okay. All right, now I'll share my story. But yeah, so when I was in middle school, my mom was diagnosed with breast cancer, and I don't know if you remember being in middle school, but like I feel like I was kind of like, what? Like, I don't even know what cancer is at that point. You know, I was worried about playing softball and soccer and kind of doing my own thing. So it was very stressful. It was weird because I wasn't very knowledgeable. Like I look back at it and I'm like, wow, my mom is stronger than I ever even knew. Like, because I now treat patients who are exactly her and going through exactly what she went through. And I'm like, I don't know, it just kind of gives me a larger appreciation for my mom and what she accomplished with 2 kids and just, but yeah, so that's another story of how much I love her. But yeah, so she went through bilateral mastectomy, reconstruction, radiation, chemotherapy, and she's doing good. She's doing wonderful now. She's now 16 years out, I believe.
Oh,
Um, I'm turning 30 this year, and that was around, well, maybe even 17. But yeah, she's doing awesome. And so she ended up getting lymphedema. We can't really remember the timeline. Her and I kind of are like, but I know she got a lot of cellulitis infections, which can happen. So basically, what happened with her, and what I tell my patients what happens is when you have cancer, they remove the tumor and then they also remove lymph nodes because either the lymph nodes are affected or they're concerned about it. So they've removed lymph nodes. So what I like to tell my patients is that all of the vessels that are bringing the lymph fluid to that lymph node are a little bit distressed or frazzled. And I like to think of it like all of these cars lining up the arm to go to their garage is now gone. So say like all these cars going home, and then they get to the armpit and those garages are gone. So they're like, well, where do I park then? I park at the next lymph node. I park on the street. I park down here. That gets backed up. So what happens is those garages are gone. The cars are like, I can't go home. I don't know where to go. So it gets filled up. So that's one of the main things that happens with breast cancer related lymphedema is that the lymph nodes are removed, then the area is radiated. So now those lymph vessels are even more confused because they're like, okay, my garage is gone. My road is now on fire. Like,
Yeah.
where do I go?
It
So
sounds like
all
a post-apocalyptic world.
yeah, like I imagine in my mind and I'm like, yeah, like these vessels are like have such a role, such a job. They're helping us so much. And they're like, what's happening? Like their roads and the map is just totally disrupted. But the good news is that through lymphatic drainage and through self massage, through different garments, through different techniques, we can actually train those cars to find new garages. We
Yeah.
can train those cars to those people in those cars to hop into another car, some anastomosis of just the vessels connecting with other vessels. So it's trainable, but if you just let it build up, build up, build up, then it's harder to train and train. So I just maybe my little like warning or not warning, but little PSA or something is like,
Yeah.
if you're noticing swelling, tell your doctor. And if your doctor's like, oh, it's okay, do your own research. Like message me or message a lymphedema therapist and just say, hey, is this normal? Because sometimes I'll get people in that early stage and we can retrain it so they don't end up getting lymphedema.
That's awesome.
So anyway, so my mom got lymphedema. She got a bunch of infections and then she just wasn't getting better. And this is when I was in college. And so I was like, all right, well, she's not getting better. It's just getting worse. She tells me she wasn't the best patient too, so that has a lot to do with it. But I'm like, nobody wants lymphedema. Like it's kind of like they beat cancer. They go through all these things that are so difficult on the mind and body and then they're like, and now I have this heavy limb that I have to carry around. It's kind of like a reminder of the cancer, which is a little bit, not a little bit, a lot to deal with.
Yeah, psychologically, that would be a lot of mountains to move to handle.
My mom and I joke and we're like, the gift that keeps on giving. Like you you have to find humor in it because if not, it becomes depressing. And I've seen that happen. So
Yeah.
she wasn't getting better. And I was like, all right, well, I had now graduated from Quinnipiac with a master's in occupational therapy. So I was like, all right, I am aware of the body. I was taught a little bit of about what lymphedema is like. And then I did a travel therapy assignment in California. I worked on like a neuro rehab unit for about 4 months or so. And I went to an in-service about lymphedema. And that's when it really clicked. I was like, I can get certified to help my mom. Like it never really kind of like, I
Mhm.
never knew that I was able to do that. And so I immediately called my mom like in the bathroom. I was like, Mom, I just went in service all about lymphedema. Like, I think I can help you. I now understand it. Like there's a certification. My mom's so funny. She's like, okay, like going online, like where can you get trained? Like, and so we found Kloss Training, who was created by this man, Gunther Kloss. He's a wonderful person. He's just such a kind soul.
KLOSS.
Klose.
OSE, excuse me.
Yeah. So, and he does trainings all over. He's initially from Germany and was taught in Germany, but he brought it here to America and yeah, it was just so it was like a very intensive 2 week course or whatever, like every day I went to Connecticut and just stayed there. But yeah, so I got certified to be a lymphedema therapist. And then I came home. I lived back in Rhode Island for a couple of years and just was like tunnel vision to my mom. Like, we're gonna figure this out. We had to. Like, it was affecting everything. She couldn't wear a wedding ring. She couldn't wear her clothes. Like, again, but going back to that kind of like emotional, mental aspects of this diagnosis, it just was like wearing on her. So I literally massaged her, compression bandage, massage for 2 weeks straight to decongest the limb. So that's a one way of treating is called CDT, complete decongestive therapy. And basically what it is skin hygiene, compression bandaging, compression garments, self-manual lymph drainage. So it's basically this intensive treatment for 2 weeks that we
Wow.
massage, compression bandage, massage over and over and again to get the limb down. And then we measure for either custom or off the shelf garments to keep the arm down.
Yeah.
So we did that and she improved so much. Like, her arm just, we could see it going down. And it was just like, gives me chills kind of thinking about it. Yeah.
Tell me your mom's name.
Tina.
All right, you gotta give a shout out to Tina. Thanks, Tina, for creating this beautiful human who then was able to help you in return. And that's such a beautiful story. And I love the idea, not the idea, I love purpose because that's the why. And when that why is so strong, it doesn't matter like what obstacles that you will have undoubtedly because you keep coming back to that source of why are we even doing this, and it's always just to get better, whether it's us, ourselves, our loved ones, our patients, and usually it's all of it. But that's really a beautiful story, and thank you so much for sharing and sending love to Tina and her arm. And you got to wear that gold, girl. Got to get that jewelry back on. Got to
Yep.
get that jewelry back on. As you were describing this, I had another kind of like definition vocabulary story. So this is going to be a test to see how well I understand this. But when we're talking about lymph in the blood vessels, we're talking about the arteries and the veins. And if I have this correct, the arteries and the veins, but I think it's the arteries go away from the heart, the veins go to the heart, and the lymphs are only a one-way pump, correct? So
Yeah.
is it just the veins going
So
to?
there's actually, so there's arteries, you're absolutely right. Arteries going away, veins going back. Lymph vessels are a separate vessel.
Oh,
They're actually going next to them.
okay,
Yeah. The lymphatic system
okay.
actually is its own vessel, own system that moves the fluid. So the veins kind of drop out some of that fluid, or the arteries drop out some of that fluid. The lymphatic system is the busboy that takes that fluid back.
It has
So
its own pathway that
own
it's,
pathway.
is it
Yeah.
attached to the arteries and veins?
Not attached, but directly, almost like I've heard another analogy for you is
Yeah,
I've heard of it be like a train station where like the heart is the train station, but the blue, the red, and the green line are like the lymphatic system, the vessels, the arteries, and the veins. So they all have a connection with the heart, but it's three different trains.
that's really interesting. I really thought it was just part of one of them, but it's its
I'm
own.
glad you clarified. Yeah,
Me too.
yeah. But you're
Me,
right.
me too. All right, so this is probably the hardest thing that I have, like wrapping my head around this is what exactly, what is lymph comprised of? Like I understand that its role, as you so beautifully uh, defined, is like it's cleansing, it's clearing, it's helping with the flow and regulating the flow, it's cleaning up the mess that's being left by the heart and essentially all these pumps. And I think actually, okay, two-part question. What exactly is the lymph that's in this third track? And then where are the lymph nodes where it's basically being deposited into?
Yes, good question. So basically, I'll kind of go big picture first.
Yeah.
And this is so good because I think this is really important because people are having these questions, like, and it's important to know. So in your whole entire body, there's about 700 or so lymph nodes. A
Okay.
majority is surrounded near your joints. So you have a lot of people know of the ones near their neck. So, you know, if a doctor ever kind of like touched around the lymph nodes around the neck and they're like, oh, that lymph node feels a little swollen, you know? So, a lot of people are aware of those because of a doctor's appointment. They check those out. So, other people who've had cancer are more so aware of the axillary or inguinal lymph nodes underneath the armpit or in the groin. So, about 700 or so in the body, a majority is actually in the abdominal region to help with the digestion.
Right.
There's so I've heard there's about like 300 or so in the belly, about 200 or so in the neck and the chest. So this area has a ton. And then there's about 30 to 35 or so in the armpits. And then same thing for the groin, the pelvic area. And then there's some in the inner elbows, behind the knees. So
Yeah.
kind of, and
It's
they
like
can either
all the nooks and crannies.
yeah, exactly. And they can either be in like clusters of lymph nodes
Yeah.
or they can be in like lines of lymph nodes too.
Okay.
So they come in like kind of different formations. And then it can be really big ones or really tiny ones too. So basically the lymph nodes are our surveillance team of the body. So if we think about the heart pumps the blood, some of that fluid goes into this space called the interstitium. The lymphatic system has little finger-like capillaries. So they basically take that excess fluid, bring it into a lymph vessel, and that's where it becomes lymph. So in that lymph vessel, there's something called the little lymphangion that basically contracts and releases, and that's what opens up the valves to pump the fluid. So the fluid in there is water, it's protein molecules, it's different cells, it's different debris, it's kind of whatever fluid is floating around in the body. And I think there's 5 different components of what exactly lymph is. I'll give you those afterwards. I can't quite remember, but basically that fluid is pumped through these vessels, like you said, a one-way path back up to the heart. But the lymphatic system doesn't have a central pump like the heart does. So the lymphatic system has to move with our help through breathing, through movement, through external compression, through lymphatic drainage massage. So all of that fluid is moving from the feet all the way up, getting filtered by the lymph nodes behind the knees, coming all the way up, getting filtered by the lymph nodes in the pelvic area, coming up through something called the thoracic duct, all the way up, and coming back to the heart. For the arms, it goes from the fingertips, gets filtered by the cubital fossa, the inner elbow, all the way up, gets filtered by the axillary lymph nodes, back to the heart. Same thing with the other arm. The head and the neck come down, get filtered by lymph nodes in the neck, and then back to the heart. So everything's coming back to center.
That's really good. Okay. So one of the things that I think is actually that I'm just so incredibly grateful for is I can remember being on the other side of where I am, where I was extremely unhealthy, extremely dysfunctional, and had no idea. So basically completely oblivious to the fact that I was slowly killing my body. And I can remember that old parent would say like, well, I don't have any large limbs. Why would I need to do this? And then the new me is like, it feels so good. Get yourself a dry brush. Why would you not want to do that? So this is like a friendly devil advocate question. How would you reply to someone that is having a hard time grasping the importance prior to having lipedema or lipedema extremities that are starting to engorge or fill?
Yeah, that's a great question. And I wouldn't know that answer unless I've been through it. Like I'm exactly the
Yeah,
same way.
yeah, yeah.
Why would I do that if I didn't need to? You know, why am I gonna help my yeah, I know you mean it.
Yeah,
And I think that's a lot of our culture is this like reactivity of like,
yeah.
oh, something's wrong. Now let's fix it. But so the lymphatic system is in touch with every part of your body, has to do with every system in the body. So if we help this one system, we can help all the other systems. So basically, if you think of that fluid, if we have it free flowing and moving, think of it like a stream kind of going through, and that stream is clear and no stagnicity. It doesn't have any mud or anything. It's just kind of flowing through. So if we improve this flow of our body, then it doesn't have a chance to become this stagnant pond where bacteria forms, where stress gets held, where we have these like
There's always a bunch of flies hanging around
always a
too.
bunch of
Yeah.
flies, yeah, like a bunch of like weird things. Yeah. So if you think of it like that, what would you rather have? This like
Oh, yeah.
crystal clear. And I, as you know, work a lot with the lymphatic system, with energy, and with like how that affects our chakras and how that affects the movement of our flow of our mind and our body and our soul. So what would I rather have, this stagnant, tight, non-moving energy, or this free flowing, like beautiful, crystal clear, like um, movement in the body? So I think that's why doing lymphatic practices are so important, because it helps our lymphatic system. It says, hey, here's some help. Like the lymphatic system needs help, because naturally, if when we're just sitting here, our lymph fluid is moving super slow. So it's moving like every 15 seconds, like boom, boom, like so slow. But when we do activity, when we breathe with the respiratory changes and the pressures, we can get that fluid to move beat per second. So that in itself is worth it.
Yeah, and in this conversation, it's just reminded me of, when you start to get like an idea and you don't have like fully have it grasped, but something that has been playing in my head through reading this and through our conversation and through following what you've been doing, as well as taking some of your lymphatic flow yoga classes, is I'm just understanding we are not meant to be static. Like the body, the bones, the muscles, the breath, the lymph, the blood, all of it has got to be able to move in this fluid dynamic motion. And so then even kind of going from, I, I really love talking about parasympathetic and sympathetic nervous systems, but really it's the whole body. So there's always a purpose for whatever tightness, like what that initial, whatever it is, like to safety, to ball up as small as you can to protect yourself. And there is a point where that is needed. You don't want to be open and vulnerable if you're under attack, if you're in danger. But as a society, we just get stuck there. And that goes for the flow of our blood, the flow of our breath, the flow of the lymphedema, the flow of our muscles, our spinal column, all of it. And essentially, I, I can just tell the conversations with people that have not quite reached this understanding. Maybe they never will. Maybe they don't even want to, because it's a lot of work psychologically, physically, mentally, spiritually, to start to open yourself up to this ongoing flow, because that means that you have to deal with maybe some stagnant water, some flies, some things in your past. You have to change some of your behaviors and patterns to continue to let it flow, to filter it. And this is like a really huge metaphor, but just hearing you talk about the purposes and the benefits of working on your lymphatic system prior to that dam clogging up or a lymphedema extremity, it also kind of reminds me of like why we actually want to continue breathing. We want it to be deeper. It's just a whole system. The body is a whole system. And I go back and forth between like, this is amazing to holy shit, I'm so overwhelmed. Like literally, it depends on what day it is. But on my good days, I am so blown away and humbled by the amount of intention that is in each and every one of our systems. And if we can look at something that's happening not as you're in danger or you're about to be harmed or you need to close off, but only as messages of pay attention to this, pay a little bit more support to that, start to move your body. You've been still for way too long. That always gets me really, really excited. And I think you've described lymphedema and the lymphatic system really beautifully. And I'm just hearing the ongoing, this is why I'm having this thought, because it's through the book and through our conversations and what you just said. It's about flow. It's never about being still. And I even think about it from like the fascia system or our bones. Like bones are not meant to be fused together. They have tendons and ligaments so that they can move with dynamic integrity. And same with our fascia. It's supposed to be like the suspension system. It's not supposed to adhere like fascia adhesions together. I'm still dealing with that like in my ribs. I'm like trying to move my rib cage, but it's just stuck up together, trying to peel back those layers that got it there. Because at one time it needed to be contracted. It was in a stressful situation, but it's not anymore. It's still stuck though, slowly kind of getting up and out. But um yeah, so that wasn't really a question. It was just an observation. I just am seeing like flow everywhere. Like we want dynamic, not static. We want movement, not stillness. Well, stillness in the mind's good and sleep's good, but overall, those
Yeah.
things. Would you agree, or do you have anything to add to that?
Yeah, that I love what you just said, because that really kind of pulls it all together, is that, yeah, when we are stagnant and we're complacent and we don't, also I think when we don't understand or have been provided with the tools, I think that's a lot of it too. Like, I while you were talking, I remembered this a story of my patient. She had breast cancer and she was coming to see me for lymphedema, and I was doing the massage on her and teaching her how to do diaphragmatic breathing, how important that is for the movement of the lymph flow, and how, like, as you breathe in, the diaphragm sits down, and then as you breathe out, everything sucks back up and into, like, it acts as a vacuum to pull that lymph fluid from the lower half of the body up, and how important it is for just, again, tapping into the parasympathetic nervous system, allowing for that rest and digest. And so I was, week by week, I was kind of teaching her bit by bit. And then after, I think it was one of our last sessions, she was like, I feel like I'm now in my body. And I was like, what do you mean? And which I knew what she meant, but I wanted her to, like, kind of share. And she was like, well, I feel like through the cancer treatments, through all of, like, getting lymphedema, through all these, like, hardships and all these things, I've been trying to escape my body. And I think this could go for anyone with an eating disorder, with um, any type of dependency on medication, with any type of addiction, like you've talked about. Like, we're trying to escape our body, and we're like trying to, like, run away from this feeling of stress, and finally she was able to, like, sit with it for a second and be like, oh, I can go home, I can be home and be okay, and, like, I can do X, Y, and Z to help myself. So I feel like that, but it's, she didn't realize that until she was guided and told, she and gave permission that she could do that. Yeah.
You're exactly right. You don't know what you don't know, because we're well, one, there's no way we could fully digest all the information at once. And you almost have to have the context to be able to understand what you're being told or what your body's telling you. And I just know that there is no right time, there is no wrong time. It's just when you're able to grasp it and when you're able to understand it, if you're willing and if you'd like to. And this is just kind of making me think a little bit. I know on Instagram we had talked a little bit about Reiki. So I'd love for you just to share a little bit about your Reiki practice, how you intertwine it. Ooh, my executive.
I thought it was
Assistant, Vanna White is here. Do you have something to say? No, she heard Reiki.
I was like, either it's the dog or it's some type of universal energy shifting things, which I'm also open to. So.
Yeah, no, I was gonna say, so I have level 1 Reiki, and mostly I use it and got interested in it because I just needed more tools to help to safeguard my emotional well-being. So lots of times when we go in and healing professions, and I mean this has been present ever since I've been a speech pathologist. Like normally speech is the least of what's going on. There's always more. There's always more. That's just the very tangible, visible part. And I don't know if you noticed this as you were working as an occupational therapist, and even like as we dive deeper into helping others, you have to really make sure you are regulated and you are okay, and that your breath, your nervous system, your body knows that this is safe within us. And also boundaries, always learning about boundaries. So for me, Reiki,
I want
excuse.
a dog so bad, so this is, like, making me so happy.
She owns the home. She's like, boundaries. Let me push these boundaries. And if you're listening to this, my dachshund is full on made her cameo. She is here and She wants to be the center of the universe. All right. So Reiki essentially is a flow of energy, and it's just another, to me, it's almost like another tool of how we continue to let things not get stuck, or at least be able to better understand them. And I did it for myself, really just trying to make sure that I could listen to my body when it was telling me, like, girl, you've had enough, or to lean into this, or pay attention to this. And it's been extremely helpful. And also, I just gently kind of start to use it to help other clients listen to what are their hard yeses and their hard nos. And I'm very, very, very early on in my Reiki journey, but I would love to hear how you're using it, what it's been helpful for, and anything you'd like to add.
Yeah, yeah. I've been practicing Reiki for about 10 years.
Ooh,
And
yeah.
yeah, I started in college, and right at the beginning. Yeah, so about, yeah, 10 or so years, or 9 years. But I am now, so I did level 1 and 2 when I was in college, and I just recently did level 1 and 2 again, and I'm working my way to be a master. In a couple of weeks, I'll um, become a Reiki master. Yeah, but I think it's just such a powerful tool. I think that everyone has this capability of um, bringing universal energy and bringing good energy to themselves. I think that we all are capable of doing it. It doesn't take any special type of person um, and I know that for a fact because my fiance Danny, he never did yoga, meditation, or any of that really before we met. And so now we've been practicing yoga all the time together. And he actually did a level 1 Reiki training with me. And he was not somebody who had ever done anything like that before. And he was doing it on me. And I was like, I feel everything. Like you're so powerful. You can do this. And I think everyone's capable of that. It's just about, so basically you go through this attunement, as you probably remember, where the Reiki master gives you these symbols where you recite in your mind, and then you're attuned through their Reiki energy. And then essentially all it is just intention. It's just having the intention of opening up this space of, hey, we're going to heal you. We're going to try to send energy where it needs to go. And then the energy I'm just a channel for that energy from above, from the universe, from nature, to flow into this person through my body. And it sounds very like what? But I believe in it. I feel like I believe in it because I have the facts that it works, or the experiences that it works.
My favorite quip back when everyone's like energy. I'm like, well, have you ever had goosebumps? Like, what do you think that is? What that is a tangible symbol of the energy flowing through you. I'm just looking at the time. I want to be conscientious and respectful of yours as well as attention spans. But I would love to kind of like getting towards the tail end. What are some of your favorite ways, coming back to move lymph, excuse me, not what about that lymph? How do we move the lymph? What are some of your favorite ways? And just, I would say that people can begin to explore maybe in their own body, their own practice, ways that they can begin to pump this fluid in an effective and functional way.
Yeah, so I created a type of yoga, as we talked about, called lymphatic flow yoga. And I created it because during the pandemic, I had just moved to Boston. And so I moved away from my mom. And so I worked on a COVID unit for 6 months during the pandemic. So I wasn't able to see my family because risk of giving them COVID. And I just was in the hospital all the time working with patients. So I started lymphatic flow yoga wellness programs, so virtual wellness programs for people with lymphedema and lipedema. So that's where it was born, was through this really trying to keep an eye on my mom virtually because I couldn't be in person with her. So I was like, well, mom, let's do some yoga. And she was not a yoga person at all. No one really in my family was, but now my dad comes to my programs. Like before my grandfather passed away, I had him do my programs. Danny does my programs now. So, but anyway, so this practice, it's called lymphatic flow yoga, and there's 4 components, and these components that your listeners can do to help themselves move the fluid. So it's diaphragmatic breathing, so deep belly breathing, which I'm sure if your followers are listening are aware of that type of breath. That helps a ton. manual lymph drainage. So draining your central lymphatics through a type of manual massage, which I have a ton of free YouTube videos on Balance with Babz and a ton of resources on my Instagram too of how to do that. Muscle movement, so stay active, whatever that means to you, walking, cycling, swimming, rebounding, dancing, Zumba, and of course yoga, but getting some movement throughout your day will help the muscle pumps, the activation of the muscles to move the fluid. And then the fourth component of my practice is mindfulness. So really allowing yourself to be with yourself and notice where you feel some stuck energy, stuck fluid in the body, and then listen and kind of and respond. And I like to say, in order to heal, you must feel. So being able to feel what's going on is super important. So those are the four components of my yoga practice. It's the diaphragmatic breathing, manual lymph drainage, the actual yoga poses, and then mindfulness. And I have a ton of free classes on my YouTube channel, and I teach every Monday night at 6 on Zoom. And then I also host a 6-week yoga wellness program for people with lymphedema and lipedema too.
And let's go ahead and shout those out. Tell us your YouTube handle or the YouTube channel. How can they find you there? And then your Instagram handle and any other information for people to get in touch with you.
Sure, yeah. YouTube is Balance with Babz, so balance with and then BABZ. And then Instagram, it's Balance with Babz Yoga. And then you can go on my website to see all of my programs or sign up for my Zoom. So every Monday night, I teach a donation-based class. So it's $10, and all of that money goes towards a scholarship program. So a lot of people with lymphedema and lipedema have to pay for their garments, have a lot of medical issues and medical bills. So I have a scholarship program that they can apply for if they need help. So every Monday night, those donations go towards it. So but yeah, Balance with Babz, if you just Google that, you'll find me.
Wonderful. Well, we have time for one final question. It's the one that I always ask all my guests, and this can go in a very anatomical way, or it can go in a metaphorical way. But essentially, Babz, what does a deep breath mean to you?
As I take a deep breath. I knew you were gonna ask this, and I had so many thoughts of where this could go, but I think it just means control. I think that all of us as humans and as beings, and we're all looking for this sense of control. And I think a lot of times with a chronic condition like lymphedema, lipedema, or an addiction or anything that's kind of like hanging on to you, you feel like you're losing control. And I think the fact that taking a deep breath gives you back the control, like allows you to really focus on I'm here, I can control that breath, and with that control I can manipulate how I feel and then manipulate how my body feels. So I think the ability to take a deep breath just allows me to refocus my attention to the fact that I am in control and that we are all in control, maybe not of everything, but we are in control of how that deep breath feels and how we think about that deep breath and how our thoughts can create sensations. And but yeah, I could go into that's a whole nother topic. But yeah, I think it was just knowing that having a chronic condition doesn't mean loss of control. Like you can always find something to help you and know that there's guidance out there and to reach out if you feel like you are losing control.
Yeah. Oh, that's beautiful. Beautiful. Well, Babz, the last little thing I want to say before I let you go is my last remaining grandparent's name is Barbara, and we call her Babz. And so ever since I was like, Babz, like you don't hear many Babses. And I just thank you so much for your light and your joy and for helping to bring a little bit more awareness to this like the underdog system of the body that I think has a lot to offer. I really just thank you for your time and thank you for being my guest.
Thank you so much. I really enjoyed talking to
Until we breathe again.
you.